Have you ever heard someone say, you can't prevent concussions? That's partly true. We can't prevent every concussion, but a better way to think about it is this. Can we decrease the risk of getting a concussion? And that matters because concussions affect how your brain works, how you feel, how you learn, and how you play. So today, let's talk about a few simple ways athletes, parents, coaches, and schools can help lower concussion risk. Hey, I'm Dr. Michael Steiner. I'm a doctor of physical therapy with over 15 years of experience specializing in concussion, headache, and vestibular rehabilitation. I help people understand what's driving their symptoms so they can recover as quickly and safely as possible. Head protection. So helmets do not make you concussion proof, but the right helmet can help reduce your concussion risk. So the Virginia Tech Helmet Lab tests helmets and gives independent ratings based on how well they reduce concussion risk. They recommend choosing helmets rated 4 or 5 stars whenever possible. And remember, the best helmet is not always just the most expensive one. Make sure it fits well, is designed for your sport, and is worn correctly every time. Second, wear a mouthguard when your sport requires or recommends one. Now, mouthguards are best known for protecting your teeth and your jaw, but research, especially in ice hockey, has found that mouthguard use was associated with about a 28% lower concussion rate across all age groups. That doesn't mean a mouthguard prevents every concussion, but it is one more layer of protection. Third, do a proper neuromuscular warm-up. That means a warm-up that includes balance, strength, jumping and landing, control, cutting, and more sport-specific movement, not just jogging a lap and stretching. Now, in a study of schoolboy rugby players, teams that completed a movement control warm-up at least 3 times a week had a 72% reduction in overall match injury. Let me say that again. A 72% reduction in overall match-related injury and a significant reduction in concussions. They say the best ability is availability. If you are injured and not playing, you can't train and compete. The secret is that the things that keep you healthy are also many times the same things that increase your performance and make you a better athlete. The key is not just doing the warm-up, it's doing it well, with coaches giving feedback on movement quality. Here's an example of the warm-up used in this study. So feel free to pause the video and take a screenshot at this time. Fourth, rules do matter. So in youth and adolescent ice hockey, removing body checking decreased concussion rates in games by about 58%. And more years of body checking experience was not shown to protect players from concussion. In American football, limiting the number and duration and intensity of contact practices has been linked to an overall 64% reduction in practice-related concussions across all age groups. So safer rules do not mean weaker athletes, they mean smarter protection. The big message is this: we may not be able to prevent every concussion, but we can lower the risk. Choose the right helmet, wear a mouthguard, use a quality warm-up, and follow safer rules. Always speak out if you hit your head or do not feel right. Protecting your brain helps you stay in school, stay in sports, and stay healthy for the future.